This is the fifth and final video in the home health billing series. We're going to cover the detailed information required when billing the period of care claim and review some claim variations. Just like we reviewed the required fields and information needed in those fields on the NOA, we'll do the same for the period of care claim. Starting with claim page 1, you'll see that a lot of the information we needed on the NOA we also see on the claim, such as the beneficiary's Medicare number and detailed beneficiary information such as the last name, first name, middle initial if they have one, their full address, date of birth, and sex code. The Home Health Agency NPI is also required, along with the statement from and through dates and the admit date. Also required is a type code, which is any appropriate NUBC code for the admission type, the source of admission, which is any appropriate NUBC code for the source of admission, and the patient status. Here you need to report the patient's status as of the to or through date of the billing period. And again, any appropriate NUBC code should be entered in this field. And just a side note here, the NUBC is the National Uniform Billing Committee, which maintains the standard data set used for billing healthcare claims. Continuing on with claim page 1, we see the condition code field, the occurrence code and corresponding date field, the facility zip code where you report your agency's zip +4 code, and the value code field. The condition code field is an optional field, and on period of care claims, this field can be used to report condition code 54 if there are no skilled services being billed, but there is a policy exception that allows billing covered services such as home health aid services or medical social worker visits provided during the period. The occurrence code field with the corresponding date is used to report occurrence code 50, which is required on all period of care claims to reflect the OASIS completion date. This field is also where you have the option to report either occurrence code 61 or occurrence code 62 to indicate an inpatient discharge within 14 days of the home health admission. And finally, on claim page 1 is the value code field. There are 2 value codes that are required on all home health period of care claims. Value code 61 is reported with the appropriate core-based statistical area code or CBSA code, and value code 85 is reported with the appropriate Federal Information Processing Standards code or FIPS code. Both of these codes need to be 5-digit codes entered with 2 trailing zeros. Claim page 2 details all of the visits the patient received during the period of care. We talked about how all services provided to the patient, whether covered or non-covered, need to be reported on the claim. So this claim page basically tells the story of the period of care you're billing because it reflects all of the services for the beneficiary during the billing period. The first revenue line you need to report is the 0023 line, which requires a HIPS code, total charges, and a service date. The HIPS code can be any valid HIPS code under PDGM. The service date should be the first covered visit provided during the period of care for the initial period of care. And for all subsequent periods, the 0023 revenue line should reflect the date of the first service provided during the period, regardless of whether it was a covered or non-covered service. No units of service are required on this revenue line, but total charges do need to be entered and the charges should reflect 0. Now, all services reported to reflect all of the care provided to the patient during the billing period need to have an appropriate revenue code for the type of service, a HCPCS code, if appropriate, a service date, total units, and total charges. All of the disciplines reported on a home health claim require reporting the total amount of time for each visit. In the course of a single visit, a nurse or a qualified therapist may provide more than one of the nursing or therapy services reflected in the discipline code reported. A home health agency must not report more than one G code or discipline code for each visit, regardless of the variety of services provided during the visit. In cases when there is more than one nursing or therapy service provided in a visit, the home health agency must report the appropriate G code which reflects the service for which the clinician spent most of his or her time. And this time reporting of units chart helps determine the number of units that should be reported based on the total amount of time for a visit. As you can see in this chart, any visit less than 23 minutes is reported as 1 unit. So all visits up to 15 minutes are reported as one 15-minute increment regardless of the length of the visit. Visits longer than 15 minutes are rounded to the nearest 15-minute increment up or down. So for example, a 5-minute visit is counted as one 15-minute increment or 1 unit. A 20-minute visit is counted as 1 increment or 1 unit. And a 25-minute visit would be counted as 2 increments or 2 units, and so on. Claim page 3 is where we have the payer information. When discussing the NOA, I mentioned that the NOA is always submitted as Medicare primary. That may not be the case with the period of care claim, so make sure your information in the payer field is correct depending on whether Medicare is the primary or secondary payer. The release of information field needs to have an appropriate indicator, Y, R, or N. The diagnosis code field is where you report the principal diagnosis that will place the claim in the appropriate PDGM category for the clinical group, and you'll also want to report all other diagnosis codes that will accurately record what is driving patient care for the billing period. There are 2 fields to report physician information. The attending physician field is where you enter the individual physician NPI and the name of the physician who signed the plan of care. This physician NPI must be in PACOS as an eligible specialty to order and refer services under the home health benefit. If the physician who certified or recertified the patient's eligibility for home health care is different than the physician who signed the plan of care, then you need to report that physician's individual NPI and name in the other physician field. This physician NPI must also be in PACOS as an eligible specialty to order and refer services under home health. In most instances, the Centers for Medicare and Medicaid Services, or CMS, expects that the certifying or recertifying physician is going to be the same physician who signs the plan of care, in which case you would only report the NPI and name of the physician in the attending physician field. You would not need to report in both the attending physician and other physician field. Claim page 4 is where remarks are entered. However, remarks are not required on an initial claim submission unless you are submitting a claim with a request for a late NOA penalty exception. Remarks are also recommended if you're going to adjust or cancel a claim to explain the reason for canceling or adjusting. Claim page 5 reflects the patient's name and Medicare number. Just as discussed when reviewing the fields in the NOA, these fields should automatically populate. However, depending on which software system you're using to bill, they may not. If Medicare is billed as primary, the patient's name and Medicare number are required in the insured name and insurance number fields. Keep in mind these fields need to agree with the payer information from claim page 3. So if Medicare is not the primary payer, the first line on claim page 5 needs to reflect the insured name and payer of the primary insurance. One more topic to cover when talking about claims is claim variations, meaning claims that are not 30-day continuing care claims. Under PDGM, there are a couple circumstances in which a partial period payment adjustment is applied. A period of care will receive a partial period payment adjustment if a beneficiary transfers from one home health agency to another in a 30-day period, or if the beneficiary is discharged and readmitted to the same home health agency within 30 days of the original 30-day period start date. The case mix adjustment payment for the 30-day period is prorated based on the length of the 30-day period ending in transfer or discharge and readmission. A transfer is when a patient chooses a different home health agency than the initial agency that opened the admission period for the patient. When a transfer occurs, the receiving agency is required to coordinate the transfer with the agency that has the open admission period. The receiving agency is required to document the date they contacted the agency that currently has the beneficiary under their care, and also document there was an agreed upon transfer date and notate that date. The agency needs to explain the transfer process to the beneficiary, and the NOA for the new period of care must be billed with the condition code 47. The agency that's transferring the patient out of their care should submit a discharge claim with a 06 patient status code, and this is the claim that will receive the partial period payment adjustment. A discharge and readmission occurs when a patient is discharged from home health but returns to the same home health agency within the same 30-day period. In discharge and readmit situations, the first period of care is billed and adjusted with the 06 patient status code and receives the partial payment adjustment. And then the subsequent period begins based on the readmission date as reported on the NOA. The last claim variation is the low utilization payment adjustment, or LUPA. Generally speaking, a LUPA is a per visit payment for periods with a low number of visits. Under PDGM, each case mix group has a LUPA threshold assigned to determine if the period of care should receive a LUPA payment. So the LUPA threshold varies based on the case mix assigned to the period. A LUPA is paid on a per visit basis using the national per visit rate. This threshold is determined by the 10th percentile of visits in each payment group with a minimum threshold of 2. So the LUPA threshold range is between 2 and 6 visits for a 30-day period. LUPA periods that occur as the only period or the first period in a sequence of adjacent periods receives an increased payment for the front loading of assessment costs and administrative costs, and this is known as the LUPA add-on. And that's it. This concludes our series on home health billing. You made it. Thank you for watching this video series. We hope this information has been helpful in helping you better understand the home health billing process. Take care.